Okay, hi everybody. Welcome to Reducing Barriers to Mental Health Help Seeking in Adolescent Athletes. We're going to have a great lecture today. If you want, you can turn off your camera. I don't need to be seeing you. If you don't want to, then that's fine. But I will ask that you please mute yourself. To do that, we can scroll our mouse to the bottom of the screen and you can see the buttons for camera and microphone. While we're down here, if you are hard of hearing or just like to read along, you can turn on your captions and it translates everything that we're saying to text, which I think is really cool. In the calendar invitation that you all received, you'll have links to the course evaluation, which is optional, and the course assessment, which you need to complete in order to receive your certificate. Once you pass the quiz, you'll receive an email from Certify'em. The email will not be from Precision Athletic Training, and that will give you your statement of credit. If you don't receive it, check your spam folder. If you still don't receive it, it might be because you didn't pass the quiz. And you can try as many times as possible to pass the quiz. Okay? As of right now, we're seeing a whole bunch of people. We can change that view by clicking the top where it says everybody, and then you can click on Jen once she starts presenting. This meeting is being recorded. If you have a problem with that, please let me know. I can take you off and then get you the recording of the lecture. But if your camera's not on, nobody should be able to see you anyway. We're just going to be recording Jen's screen once we get started. Okay, a little bit about our presenter today. Jennifer is a licensed and certified athletic trainer in Connecticut, a yoga instructor, and a certified strength and conditioning specialist that has provided care for patients in both traditional and emerging settings. A graduate of the athletic training program at Springfield College, Jen continued her postgraduate education at LaSalle College to earn a master's in rehabilitation science and research the topic of mental health in the adolescent population. She spent over 14 years working in the secondary school setting and more recently became a private practice owner. Jen has spoken at several conferences on the topic of mental health in athletics and is pleased to share the continually evolving research on this topic with you today. Without further ado, Jen Turillo.
All right. Thank you so much for that introduction, Megan, and I'm really excited to be here. I've done one other presentation virtually, but man, this is really an awesome opportunity to do an EVP and be in the comfort of our own homes. So I am, again, really excited to be here and talk with you all. I've had the fortunate opportunity to deliver this lecture since my research back in 2018, and I will be 100% transparent with you that the literature continues to evolve on this topic. So when I began my research in 2018, there really wasn't a lot to pick from here. We could find information on mental health literacy at the higher and more elite levels. But my patient population for a majority of my career was the high school athlete, and you really couldn't find a lot. But the cool thing is that in the short 2 years since I began doing this presentation, papers continue to emerge on this topic. So that is really an exciting thing. And each time that I do present this, it does evolve ever so slightly as new literature comes out. So let me hit my present. I'll pull up my screen. All right, all right, so I'm hoping that you see my screen. Megan, if you don't, let me know. All right, cool. So we're going to get started, and I'm just going to run through this presentation. we're going to go through the information. There's going to be a little bit of, thinking work, and some case studies. And then at the end, if you do have any questions, I'm happy to take them. Just kind of write them down, or you can even pop them in the chat. I think Megan said that was an option as well. So as far as disclosures, no disclosures to note. I am talking about a personal story involving an athlete, and I do have permission from that family to share their son's story. And I do want to come back to that. Megan, make sure I don't forget to come back to this story at the very end, because normally I do this in person, so I don't want to forget. All right, Megan.
Certainly remember.
Okay.
I do want to add, Jen mentioned the chat feature. If you aren't seeing her PowerPoint, click on the Jen Torillo presenter option, and that should pull that up into your full screen. And then there's a chat button that you can use to ask questions. We'll be monitoring that through the event, or we'll have an opportunity to ask questions at the end. Thanks, Jen.
Yeah, no problem. So hopefully you just had a chance to look through my objectives. The biggest thing here is we're going to talk about mental health literacy. And to be quite honest, my own personal experience is I really had not heard that term a whole lot prior to digging into the research. So we are going to today talk about unique stressors to the adolescent athlete, because if you've worked with a high school student, you know that they are unique. And some people will swear like I have zero interest with working with a teenage athlete, but they have been my favorite group of people to work with, but they do have their own set of unique stressors. We will talk about stigma. We'll talk about intervention programs that are available. This is where a lot of the literature continues to grow. And at the end, we're going to tie it all in together as what can we do as athletic trainers, and what role do we play in mental health and wellness. So this is the personal story that I referred to. Again, at the time of designing this presentation, he wasn't as well known as he is now. But this is Tyler Holinsky. If you are on social media, you may have heard of Holinsky's Hope. He was in Washington State. His family now lives, I believe, in South Carolina. And 21 years old, January 2018, Tyler took his life. And I didn't know Tyler. I didn't know anything about his story. But again, the power of social media here, I remember reading about this and thinking to myself, wow, this young man, has this athletic career, well-liked, and what was happening behind the scenes that something like this took place. And if you read about his story, and his parents are wonderful, they now travel telling Tyler's story. They have done things with Big Ten. They have really grown in the past 2 years. But unfortunately, Tyler's story is not as unique as we might think. And depression can start as early as late childhood. We're talking about like 10, 11, 12-year-olds. And I have a 10-year-old, and that really kind of hits home for me. And, depression can even begin as late, or as early, as late adolescence. So 20 to 30% of teenagers will kind of have a sense or feel that sense of what depression truly is, 20, 30% in their teenage years. And 6% of those teens will have suicidal ideations that they actually follow through with. So May is National Mental Health Awareness Month, and they come out with lots of great social media infographics, and one of them from NAMI, the National Alliance of Mental Illness, came out with half of all lifetime mental health conditions begin by age 14. And if you're a high school athletic trainer, those are our people. And even if you're working with, collegiate athletes, or you kind of have a mix and you're doing per diem, 75% of mental health conditions will have their onset by age 24. So if we're recognizing signs and symptoms earlier on, forms of early intervention programs can truly make a huge difference. So throughout the lecture today, there's going to be a few key terms that you will see several times. Some of them, like adolescent, we've heard them. We've heard that term before, but who defines an adolescent as someone that falls between 10 and 19 years old? Pretty big span there. And another term that you're going to see pretty prevalent in this presentation today is mental health literacy. And that really entails having an understanding of what mental health is as it pertains to, signs and symptoms, being able to diagnose or acknowledge, and also is it inclusive of treatment strategies. We do see lots of things, again, on social media about stigma, reducing the stigma, break the stigma, lots of running hashtags. And stigma refers to labeling, separation, stereotype awareness, stereotype endorsement, prejudice, and discrimination in a context in which social, economic, or political power is exercised to the detriment of members of a specific group. So in other words, people who might be in treatment for a mental health condition, there may or may not be a stigma associated with being medicated or going to therapy or being viewed as weak or soft. And, we know as healthcare providers that's furthest from the truth, but in reality, this is some of the things that our athletes might face. All right, so when I refer to help seeking, we're referring to stages in the process of or encompassing or going out and getting help. All right, so the DSM-5 is going to be the latest and greatest manuscript that's going to give us these definitions of a variety of mental health disorders. So for today's purposes, I'm not going to read through them, but it is important to understand what the difference is between a depressive disorder. We hear that word thrown around pretty loosely. Oh, I'm feeling so depressed. I'm feeling so low. But it does have, a technical definition. And this is what we're referring to today in terms of this discussion. Anxiety, again, another word that we can use quite loosely, but in terms of the DSM, we're looking at fear, emotional response, perceiving some sort of threat that the body is in this fight or flight, that something bad is going to happen. All right, so here we go. So the National Federation of High School Sports has indicated in last year's numbers that we have close to 8 million athletes participating in sports, and that's inclusive of all 51 member states. Now, that number has decreased a little from years past. However, this group is by far the largest group of participants. So you can look at, NCAA, D1, D2, D3, NAIA. You can add all of those up, and high school athletes are still going to surpass that in numbers. So when we think about why do kids participate in sports, why did you participate in a sport if you were an athlete? Well, we know that there are several benefits to participating in sports that make them super attractive. We get the physical benefits, right? We see things like improvement in our cardio. We get stronger. We have reduced risk of diabetes, of certain types of chronic diseases. Our brain just works better. And think about the emotional benefits for the own mental health benefits of, the hormone levels and just those feel-good type chemicals in the body. And participating in sports can also play a role in building resilience, having good self-awareness, and confidence building. And that is huge, particularly in that adolescent population when they're really looking to kind of find themselves while also trying to be accepted, from the social aspect, which, leads me to one of the third benefits of why we do the whole thing with sports is we learn really important things like working together, how to deal with conflict. We learn leadership skills, and we just learn to develop relationships, particularly with adults. So with coaches, strength coaches, athletic trainers, teachers, and also with one another. So when we talk about the word stress, we typically will think stress, ooh, stress bad. Well, not all stress is bad. That is how we grow. That is how we get better. Exercise is physical stress. But athletics not only has those good forms of stress, but we also might face situations where there are bumps in the road and challenges. So we look at things like developing our coping mechanisms and our resilience. I mean, think about a time, personally, if you played on a team and your coach took you out, and the feelings that brought on. And think about, a big team loss. Maybe you observed it as an athletic trainer or maybe personally as an athlete. We learn how to deal with those feelings and hopefully be able to move on and kind of rise above, learn. And then when we're faced with that same situation, we have these new coping mechanisms. So the literature will tell us that, excuse me, but not only do we have more acute stressors in athletics, but athletes who are students are more likely to endure something called chronic stress, which is a bit of a lower level, a lower load of stress, but over a period of time. And a lot of the studies that are emerging or recently emerged are showing that chronic stress can be almost as impactful on the individual as, a significant event. So as I combed through what was available, the studies are really showing a lot of work with elite athletes in training, a lot of emerging literature on the NCAA realm, less attention on the youth setting. So we are getting better, as I alluded to before, but we definitely still have work to do. I love this slide. All right, so the challenges of adolescence. If maybe you're a parent and you know this, or again, working with an adolescent athlete, this picture really says it all. And I can't claim to finding this on my own. I actually saw this in a lecture about concussions, and I said to myself, I need this in my life. And if you look at it, this is the teenage brain, and of course, it's meant to be a joke. It is not realistic. And you kind of look through all the little puzzle pieces, and here's the benefit of doing this virtual presentation: is you can see this up close. When I present live, it's sometimes hard to actually appreciate some of these things. But if you look kind of in the lowest bottom, close to where like the cerebellum would be, it says memory for chores and homework, this little tiny yellow blip. And the rest is just rebellion and ego and love yourself, loving others, being accepted. And I don't know, I just feel like this really hits the nail on the head here. So the challenges of adolescence, I would really not prefer to relive that time in my life. And, while there are definitely some perks of adolescence, having fun and building friendships, sometimes those situations are not handled or perceived well by all. So if we look at athletics and, the different, highs and lows that come with athletics, we couple that with things like performance in the classroom, having to apply to different colleges, physical development, and the adolescent brain. And then we couple it with social relationships. Now, we know social relationships, in the adolescent years is ridiculously important. And they're, again, looking to find not only self-identity, but how they fit into, society and the world around them. So think about when you might have applied to college. I mean, granted, I'm dating myself, but I only applied to 3 colleges. And when I talked to a lot of the athletes that I was working with, as a professional, they're sending out 10, 13 college applications. And for those who are looking to play at the higher level, the competition is very real. So if we look at underlying stress factors, not even associated with the sport that they're playing, these athletes that we work with are certainly faced with something a bit unique. So looking at depression, we usually will associate depression with this big life event. Something happened, and now I am having a hard time moving past that. So we call them stressful life events. And we look at things like a death in the family. Maybe the parents are splitting up. There's a terminal illness in the family, an injury. Think about an ACL tear or a dislocation or something monumentous that is affecting their ability to play the sport that they love. And then also there's that social, emotional component of breakups or fights with their best friends or their groups that they run with. Those can be considered stressful life events for a teenager. There is also emerging literature about chronic stress, so low load over time, and the actual impact of the development of depression. All right, so there's a few factors that I would like to touch upon when we look at depression and where it comes from. So people who have experienced major depressive episodes typically have a history of abuse or faced with financial or socioeconomic challenges that are at a higher risk of having a subsequent event, a major life event, and therefore they might have a lower threshold. Okay, so again, to reword it, a history of depressive episodes. Something has happened in the past that maybe they were requiring some sort of treatment for depression, could be related to, again, I mentioned abuse, financial, socioeconomic challenges. Those individuals are going to be at a higher risk of it happening again. Okay. Genetic predisposition is something that we should also note. If we look at genetics, if there is a family history, particularly on the mother's side of depression, that individual, that child will have a higher risk of a diagnosis of depression. So coping skills in certain individuals may be impaired, and that could be related to the stage of development that they're in. Maybe they're faced with a situation that they don't quite have the tools or the resources to have those coping mechanisms or to have resilience. Okay. And this may or may not be surprising, but gender will also play a role in how an individual responds to either chronic or a major life event. Right? Females tend to have higher instances of depression. And that comes down to the social factor, okay, peer support, really relying on the group. Their peer support, and also the real important nature of acceptance. So we do see higher reporting in females when we compare to male counterparts. All right, so let's dig in a little bit more to athletics and stress. So building resiliency and positive coping mechanisms is absolutely essential for young people to be able to navigate adolescence and to be able to do so, relatively efficiently. So we know that the literature suggests there's an emotional connection with injury. Okay, think for a moment an athlete, whether it's on the basketball court or the soccer field or on the ice, okay, who has an injury and the world around them just kind of crashes. Okay, I can tell you I've had a few of those, and I'm sure you can think of an athlete or two in that similar situation. So there are definitely studies that exist that look at the correlation between things like concussion and incidences of depression and anxiety, this worry, whether it's concussion related or musculoskeletal, of when will I get better? Okay, that fear, that worry that, God, I'm never going to move past this. I'm never going to get back to the sport that I love. So we couple that with things like immaturity. They're not able to necessarily handle these types of stressors. And it really will up that risk for our teenage population for their risk for mental health illnesses. So if we look at other sport-related factors, team conflicts, run-ins with the coach, maybe they don't feel supported, maybe they don't feel like they could talk to their coach, will certainly increase that level of stress. Playing to a certain potential or an expectation, whether that's self-driven or driven by a private coach or driven by a parent, or maybe they have an older brother or sister who went on to play at such and such level, and I need to play at that level. Other sport related factors like just losing that love for the sport and a decreased drive. And there's new literature that's coming out about an increase in stress on athletes because of sports specialization. Now, we've seen all the position statements, we've seen At Your Own Risk. They put out all these awesome infographics about our youth athletes playing, basketball year round, or hockey year round, or cheerleading. As a former cheerleader, you're doing competitive cheer year round with minimal breaks. Well, if I don't do this sport year round, well, it just shows that I'm not committed, right? It just shows that I don't want it, right? So we have this additional stressor of being committed to a sport year round, or it's perceived as I don't want it as badly as the individual next to me. So there is a study that came out in 2019 talking specifically about sports specialization, and it's through the Journal of Athletic Training, so you should all have access to it. So we look at athletes who 50% are on club teams in addition to their school-based programs. And I can speak to experience of, treating my soccer athlete, and they come in for preseason and they're like, yeah, and then I've got practice tonight for an hour, and then I've got practice again on Thursday night, and then I've got several games this weekend, while they're just getting into preseason of the school team. Okay, so when truly are they physically getting any sort of rest, or even mentally they're just going to burn out? So a scale was developed in this study to identify, is this sports specialization? So the first one, is the individual choosing a main sport? 2, are they quitting all other sports to focus on one? 3, are they training year round? So looking at 8 months or more out of the year. Okay. So two professional organizations, what truly is the age of early specialization? Some will say as early as 10. And some will say a little bit later, 11, 12. But what about sports like gymnastics, figure skating, diving, dancing? A lot of these aesthetic type sports, the Olympic Committee is suggesting in a statement made that with proper guidance, early specialization can be safe. So personally, I'm getting a mixed message. But these aesthetic type sports, they do better when they're younger. So they have to practice and train more than maybe a wrestler might, just picking sports. So just looking at sports specialization, how, the 3-point scale came out, I definitely recommend taking a peek at it. It's a very interesting article. But as we talk to parents, we can certainly get a sense of urgency about missing a practice, or maybe losing a spot on a team. Think about a particular athlete where you tell them, all right, so you have practice with me at such and such high school, but I know you're going to play AAU this weekend. You really shouldn't play to this weekend. You've got an ankle sprain that I'm treating here. Well, then now you have this added pressure. Well, oh my gosh, I'm paying for this club. I'm investing in this. So we as athletic trainers are certainly put in a position that's a bit challenging, and it's challenging for the athlete and for the parents, because there's this financial commitment. So sports specialization, here's a little screenshot of that article. One more plug about looking at stress related to sports specialization. All right, so athletic trainers are special. I mean, we know this, right? And when you work with high school athletes, your athletic training room is not only a place for evaluation and treatment and rehab and all of the stuff that we're trained to do, but our high school athletes just like to be there. They like you. They like to be around their athletic trainers, and we have this bond with our athletes, and it's to our benefit. Right. So when we talk about mental health illness, we may very well be the first healthcare provider to recognize when something is wrong. Okay, so my personal pictures here of a handful of athletes. One's the prom and one's graduation, and the bottom is an athlete who came to visit me after going on to play for Penn State football, and then went on into the draft. And he made the time to come back and visit me when he was big shot, and just thankful. So we really have the ability to be impactful on our athletes, and we as athletic trainers have the potential to mold the behaviors of our athletes because they're watching us. They might be modeling our behavior. We might not know it, but when we're faced with a challenge, how do we react? Okay, when we're thrown, adversity or a change in schedule or, a game that wasn't communicated, how do we react as athletic trainers? What words do we choose? They watch. And they also will watch our body language. So in our athletic training facilities, we can provide for our athletes a stable, positive environment where learning is always happening. So think about that in terms of being an educator and being a teacher. We are always doing that. Okay, so we're going to get into the actual research, the materials that are available to you as an athletic trainer. So there are a few things that we have that we can refer to. And one of the first resources that came out was from the NCAA, and it pertained to managing student athletes and mental health issues. It was this nice long document, and it provided us kind of with a framework of what our resources are and how to lay out a mental health emergency action plan for our athletes. So some of the sources of stress in the college athlete can parallel to that of the adolescent athlete. And, we don't really have a ton of evidence on sports psychology and adolescents, but we know that looking at our higher level sports, they might have a sports psychologist on hand. They might have a performance coach. And we're starting to see that embraced more in the college settings. And if it's happening at the high school setting where you are, that's great. That's wonderful. But there are certain things in sports psychology like mindfulness, goal setting, deep breathing, meditation that are in our wheelhouse as athletic trainers. But we need to also know when are we pulling in the closer and referring to a specialist. All right, so let's talk about, we identify a situation where we think an athlete might be someone we need to refer. What are the barriers that those athletes are facing that we should be aware of? Well, past experience is huge. Maybe they had a bad experience talking to a therapist. Maybe they had concerns with confidentiality. Maybe word got out to their coach that they had looked for treatment. Maybe it's family. There's cultural perceptions about barriers to health, and that will parallel along with stigma, whether it's perceived or self-imposed. Certain things like a personality type or a mindset. I don't want to be perceived as weak or soft. Having that fixed mindset can certainly be a barrier to reaching out and getting the assistance that could be potentially really positive. And the last barrier is something called mental health literacy. And we defined it earlier on in our little chat. So we're gonna dive into some of this stuff. So addressing stigma, both self-imposed and perceived exist, and they can cause just as much damage as the other. And they really could hinder an individual's desire to get the appropriate medical attention that they need. So emotions like embarrassment, the fear of actually going to get help or being perceived as weak or worrying about what is my family going to think of me, all contribute towards that stigma or those barriers, okay, that might prevent an individual from wanting to get help. So think about a moment when we've heard someone use the word bipolar Or did you take your meds today? We sometimes hear that as a joke. But what kind of feelings arise? Does it make you uncomfortable? Maybe not you as an athletic trainer, but maybe those around us. Okay. How does personality fit in? So our disposition or mindset can certainly contribute to barriers affiliated with seeking help for adolescents. People who are typically forward-thinking, growth mindset will perceive a challenge as, okay, I'm faced with this. What do I need to do to move past, to overcome? So they view those challenges as manageable stress, and they're willing to take the steps to set goals and trust in themselves, and will work hard to move past whatever that challenge might be. So conversely, we have more of a fixed mindset individual whose perspective might not be that optimistic. I'm going to rise above. They might view adversity as the world is happening to me. Okay, they doubt themselves. They will disconnect. They may or may not try to distract themselves, right, to try to avoid those feelings. So I love this statement: I make life happen versus life happens to me. Now, here's the thing: we talk about growth versus fixed mindset. One is not necessarily right or wrong, and we can certainly vacillate between the two. But we want to encourage our athletes to view challenge as an opportunity, view it as an opportunity to grow. Right. So emotional reactions to injury or conflict, it's completely human. And, as the adults in these scenarios in our athletic training room, it's important for us to convey, like, if you're feeling in a certain way, validating their feelings, that this is normal to feel that way. This is normal to be angry at the world right now because, you have to have surgery and you're going to miss 6 weeks of your season. That's okay. But if those feelings stick around or they start to get worse, well, that's going to turn into a different conversation. But I'm here for you for that. So mental health literacy, it's typically associated with the development of a stigma, right? So there's definitely literature that's going to show that people with lower mental health literacy, lower understanding of signs and symptoms, how to get help, what treatment might be like, there's definitely a negative effect on help seeking behavior. And it's actually one of the largest deterrents. So lacking that knowledge of mental health just in general will really play a really big part in whether or not our athletes will seek help. So school age athletes have demonstrated an inability to acknowledge signs and symptoms of mental illness in several different research papers. The literature makes reference to mental health literacy as a barrier. However, there's certainly a gap in focused research on this area of mental health literacy. So we've identified it, it's a problem, but we're still working on kind of getting the evidence that we need to really come up with procedures and protocols. So when there is a lack of understanding, this creates room for us to kind of create our own narrative, and that can lead to biases and judgment. All right, so looking at mental health literacy further, we're understanding, what does it mean to have good mental health? How do I keep it? What do I need to do in order to stay feeling this way? Identify common mental health disorders and treatment. So can I say, this is what depression looks like? This is what bipolar disorder looks like. This is what schizophrenia looks like. And this is how people get help. Minimizing stigma against mental illness. Yes, that is a component of mental health literacy. You actually play an active role of breaking those barriers and saying, well, no, if you're not feeling right, then yes, it is okay to get help. It's okay to not feel okay. And in a nutshell, what we're looking to do is enhance people's willingness for help seeking. So if we have the knowledge and understanding, we can change our attitudes. And when our attitudes change towards how we perceive mental health, then people are going to be more apt to get the help that they need. So measuring mental health literacy, how do we do it? I can't just point out to a crowd and ask questions and say, okay, well, yeah, you've got mental health literacy and you've got mental health literacy, and yeah, sure, you do too. There are ways to measure this, and there are some scales that are available that have been proved reliable and valid, but we are still working on building some psychometrics. So we have things like the mental health literacy questionnaire, we have the mental health knowledge schedule, and we have another questionnaire by the World Psychiatric Association called Open the Doors. Now, emerging literature suggests that early intervention can improve mental health literacy in adolescents. So what does that exactly look like? So there are several intervention strategies to improve mental health literacy. And to be quite honest, when I comb the research, our neighbors to the north in Canada are doing a lot of research on this. And there is a fair amount of research coming out of Australia. And for professionals like us, you may or may not have heard of mental health first aid. There's a program in which you can do this module, and it will increase your knowledge, attitudes, confidence, and personal behavior on mental health. And what's great about it is there's a 6-month follow-up. So the intervention strategies for improving mental health, the ones that are rated the best, typically have a follow-up later on. It's not just a one and done. I took the course, I got my certificate, cool, I go on my way. They actually circle back with these professionals and recheck. Are you retaining that information? I mean, let's be honest. I'm giving all this information, but we're only really going to retain just a small percentage of that. That's just how our brain works. And there's an indirect effect here through mental health first aid, and students reported an increase in information received from the staff. So really good opportunity for professionals. Mental Health America is another really great option. So there are things that we can do as professionals to seek out and kind of up our comfort level with mental health interventions and mental health literacies. So for our students, some of the studies are looking at actually having intervention programs built into the school day. So Canadian study using Healthy Young Minds. We have an Australian study, Headstrong, and then another Canadian study called the Curriculum. And the curriculum is really the only one that I found, and again, this might have changed because our research is growing. This is the largest random control trial at the time, and we know that that's the gold standard of research. Increase in literacy, decrease in stigma. At the end of the day, that's what these programs do, is they have conversations with students starting as young as late elementary school and middle school, and they feed information. And as they, matriculate through middle school into high school, the information grows. And at the end of the day, they learn, just like we learn about our bodies in health class, we learn about psychology. Okay. And they all have different facets, and they all come from, instructors who have been previously trained. And most of them are scripted. You're given an exact curriculum, you follow this, but they have all shown to be beneficial. And the ones that circle back and check in with these students afterwards, those are the ones that are the most efficient. They come back and they say, hey, remember this time we talked about this stuff? Do you remember, fill in the blank? Okay. So here in the US, we actually started to do some studies of adolescent and depression awareness programs. So between 2012 and 2015, we had a decent sized study of 14, 15-year-olds, Maryland, Delaware, Pennsylvania, Michigan, and Oklahoma. And we had an intervention group, and then we had a control group. And 80% of those in the intervention group actually improved their literacy. So 80% were considered literate. And they looked at things like signs and symptoms of depression, process of decision making, depression, and other things that might coincide. They talked about suicide, and they talked, most importantly, that depression is treatable. If we can identify it and have some sort of intervention, that depression is treatable. And I think that conversation is probably one of the most important to have, and hopefully will break down some barriers and break stigmas that just because that label happens to come your way, it's not the end. That there are things that can be done, and you can live a very happy and normal life. So we're navigating through, how school can play a role in mental health literacy, and school climate is a huge factor. So studies that have been done will suggest that investigators in institutions with increased engagement by students generally have a positive learning environment. When that learning environment is positive, inclusive, they're going to have fewer issues with stigma and help seeking. Seems pretty brainless, right? So the thing is if we're looking at school climate, this has to be done by administrators. This is not something that we would do as athletic trainers, but we should have a seat at the table for sure. We should know our principal, our vice principal, our school psychologist, our nurses. Right? And school climate is something that shouldn't just be evaluated one time. It is something that should be checked every few years, because if that changed, then the strategy needs to change. So findings suggest school climate can even drive success rates of mental health literacy programs, right? If I'm in this inclusive, happy-go-lucky environment, then I feel supported as a student and as an athlete, and I'm going to be more apt to talk to somebody if things are not okay. When depression rates or depression literacy rates are high, there's a direct correlation with lower stigma opinions. When student peers are diagnosed with a mental health disorder, there's more judging, there's more bias here. So let's talk about the impact of school climate. So we can promote health seeking in two ways when that environment is positive. Students are more likely to acknowledge signs and symptoms. They're more likely to talk about it with others and share their experiences, which in essence will help their recovery process. So school climate, never a one and done thing, out of our hands as athletic trainers, but is certainly a conversation that we should be a part of. And our health education curriculum, this is really where a lot of this should be happening. Can we do this if we're athletic trainers? Yeah, by modeling behavior, by having conversations, absolutely. But if we're looking at these programs, organized programs, this is going to be something that the health education department might undertake. And also looking at the big picture, staff should have the opportunity to be trained in mental health first aid. Okay? Coaches should be trained. Right? Teachers should be trained. Right? Just as we require our coaches to have, first aid and CPR certification, well, we should look at having mental health first aid as something that is required. Right? Think about how much time you spend with your athletes. The coach might even argue the same. I see these students, 6 days a week, maybe more, in games, and I see them at their best and I see them at their worst. Okay, so we are frontline in terms of possibly identifying mental health concerns. So here's our bottom line here. There's certainly a lack of mental health literacy in the adolescent athlete, but we can do better. Okay, mental health literacy certainly can impact stigma. Okay. But stigma is not the only issue here. We have things like culture, we have individual personalities, we have personal experience, past experiences, and those all may play a part in deterring an athlete from seeking help. Stigma is the strongest predictor, however, of a negative help-seeking attitude. So we can have an impact on stigma. We can help break that stigma by early interventions, talking about it, having conversations, possibly even initiating these programs to improve mental health literacy. And as a result, more individuals are going to recognize signs and symptoms. It doesn't just have to be us as athletic trainers. It might be coaches, assistant coaches, volunteers, parents, and in essence, we're going to have more individuals, rather than sitting on these feelings and trying to manage them with their peers, which sure is great to an extent, but if they become bigger, we need to know what can we do? Where do we go? So as we start to move towards the end of this presentation, I want to provide you with resources. So I've listened to Jen talk to me for 40 minutes or so. What can I take away from this presentation to use on, what day is it today? To use on Monday. So here we are in July. We're likely ramping up our EAPs and our documentation, and we're looking at all of our different policies and procedures. We have a few position statements that we can reference if we know or feel like I need to do a better job here. So we've got the interassociation recommendations for programs at the collegiate level. That came first. We also have developing a plan with the secondary school setting. These are all in the Journal of Athletic Training. We also have some work from the NCAA, and we also have this paper, Mental Health Issues and Psychological Factors in Athletes, Detection, Management, Effect on Performance and Prevention, from the American Medical Society position statement. Okay, and that came out in October of 2019. Here's that mental health best practices statement. Again, it's a resource. A lot of the information in the NCAA best practices you will find in greater detail in these two consensus statements in the Journal of Athletic Training. So if we look at a timeline, I mean, here we are in 2020. It's really only been in the past 8 years or so that we've started to think, hey, we've done all this wonderful work for physical injury. We need to start addressing the mental health aspect. So in 2013, we had the collegiate consensus statement. And then in 2015, we had our secondary school consensus statement. And if you have yet to see these statements, the secondary school is about twice as long as the collegiate level. And it's not necessarily because it's more complicated. It's more so we just have more information. More information is coming out. And then that last statement from the consensus statement from the American Medical Association, that came out in 2016. So here's some questions. If we're looking at our pre-participation exams, we should be asking questions about mental health. All right. So if those papers have not gone out yet to your athletes, we need to look at them. And this is coming directly from these position statements that I just referenced, but they are modified versions of alcoholism treatment quarterly. Okay, so we were like, what? Alcoholism? But that is classified as a mental health illness. And if we look at the second, the National Collegiate Athletic Association, so these are some yes and no questions that we could potentially be adding to our pre-participation exams. So yes, what can we do on Monday? Look at our PPEs. Are they inclusive of questions pertaining to mental health? So I'm just going to jump over, just because of time-wise, the NCAA statement. But there are several other papers if you're looking to read more. Again, in the Journal of Athletic Training, we look at athletic trainers and our ability, our comfort level in identifying and managing athletes experiencing psychological distress. So this is a great paper to look over. It took into account athletic trainers, and they were given certain situations. So I have a few of these case studies. Megan, do you want me to do one? I'll have you jump on if you want quickly. Do you want me to do one, or interest of time, do you want me to move on?
Yeah, let's go through one of these. I think that would be good.
Okay, cool. Let's see. I always talk about Toby. We're gonna talk about Oscar. Okay. So Oscar, in this particular situation, I will give you the cliff notes or spark notes, whatever kids are using these days, on this situation. He is a D1 soccer player, a pretty high grade ankle sprain, feels a pop, and he's going to miss a significant chunk of time. He doesn't need surgery, but he's going to miss a big chunk of his season. And he's upset, as any athlete would be. And the athletic trainer is starting to notice that this individual is starting to miss appointments. If he does come, he looks like crap. He's tired. He just doesn't look like himself. His motivation stinks. He doesn't come to practice anymore. He doesn't want to talk about soccer. He definitely doesn't want to talk about his injury. And he's withdrawn. Okay, he's moving himself away from his teammates, his roommates, and they're concerned. Right? He even makes a statement of wishing that he was not around and losing his purpose in life. Right? So we're looking at situations where he's self-treating with alcohol. And so here's our discussion. Do we, A, take no action? Do we, B, monitor closely but make no referral? Do we, 3, supervise with a supervisor? I just totally combined A, B, and 3. It's cool. Or do we make an immediate referral? All right, so think in your head, what would you do in this situation? Well, I certainly hope no one is going to take no action. Okay, if we're making statements about not wanting to be around, and we're seeing alcohol issues, this is a bigger problem than let's meditate and do some deep breathing. Right? So some athletic trainers might say, gosh, I feel really confident in my ability to handle this situation. And some might be like, nope, I'm doing automatic referral. This is beyond my scope. Let's review that based on Katie, and I forgot the year, I think it's 2012, their standards. We as athletic trainers have the capability to at least have a conversation about all 3 of these different case studies. So based on what Katie suggests athletic trainers can do, look through this list. What seems appropriate for Oscar's situation? So changing self-talk, I think he's a little beyond that. Encouraging effective communication. Well, let's start talking to this kid. Okay, hopefully you have a decent rapport with him that we might be able to stimulate some sort of conversation. Facilitating the athlete's understanding of the injury. Well, it's a couple weeks in. I think we're pretty doom and gloom about this. And setting goals. Well, maybe we could set a goal of, hey, if we're at a D1, we probably have access to a counseling center or a sports psychologist. Let's do this. I know that you're not wanting to talk about this, but we need to talk about this. Let's set a goal together. I will go with you. Let's make an appointment and let's go have a conversation. Right? Maybe it's things like helping athletes develop cues, emotional support, deep healing. So looking through this list, there are definitely things in Oscar's situation that are like, I think we're beyond that. But for a majority of things, they all certainly have their purpose. Right? So here's my take-home message. We need to identify who is on our sports medicine healthcare team. We should know this. Who in the sports medicine healthcare team that is going to be my resource in terms of mental health illness? Evidence-based medicine, obviously we want to go by research, we want to go by the data, but we also have to employ our clinical experience. And we need to make our pre-participation tools reflect what has evolved in the care that we provide for our athletes. Developing an EAP, we need to look at a situation as if we have things that escalate and it is after hours and everyone's left for the day, because we know athletic trainers, we're working late and the nurse is probably gone if this is happening at 6:30. Right? What do we do with an athlete in a situation that we perceive maybe there's self-harm or some other situation? We should not be making these decisions in a bubble. So we should be inclusive of stakeholders, okay, like our athletic director, like other healthcare providers in the school that we provide care. And if we're not comfortable with talking about goal setting or imagery, mindfulness, diaphragmatic breathing, that kind of thing, kind of the low hanging fruit that we can give to our athletes. Let's educate ourselves. Okay? Let's get better and attend varying professional development to get better and to learn the things that maybe we're not comfortable with. So going back to Tyler, his birthday just passed at the end of May, and his parents are managing what happened to their family by teaching and advocating for others and talking about mental health, particularly in sports. And I've had the opportunity to speak with his mother, and they are wonderful, wonderful people. And she sent me a bag full of Helinski's Hope bracelets. And on the inside, I didn't realize this until earlier this year, is the suicide prevention number. And it's imprinted on the inside of the bracelet, so it's not very overt, but you can see the shadow of it. So that's what I wanted to remember, that Megan, I'm not sure these individuals, if you're sending out certificates, I am happy to send bracelets if anyone would like a bracelet. I typically wear mine. Mental health is very near and dear to me and my family. But this is a quote from the Helinski's Hope website. Please remember Tyler with love and do 3 good things every day. You have no idea the impact as athletic trainers that we can have on our athletes, and it costs nothing to be kind. So do those 3 good things. You really can't ever anticipate what kind of impact you can have on someone's day. They could be certainly going through something significant, and on the outside they look, we'll say, normal. And on the inside, they could be really struggling. So by doing something good, we could really change someone's day. So this is pretty much my end slide here. Obviously, a plug for the AT Cares Committee. Laura Darby, who I know well from my years working in prep school, she is our District 1 representative. You can visit the AT Cares website, because you know what? We need to take care of ourselves too. And with COVID and layoffs and furloughs and changes in work strategies, we need to take care of ourselves, because if we can't do that, we can certainly not pour from an empty cup. We can't help others if we're struggling too. And one of my favorite analogies is the airplane mask analogy. So I don't know if you guys have ever heard that, but if you go on a plane and you have children, they walk through and they say, if for some reason the air masks come down, put it on your child and then yourself. Okay. That's really impactful. We can't help others if we don't take care of ourselves. So put on the oxygen mask, and then you have to take care of yourself also. All right. So there are resources out there for you. There are resources available for you to provide amazing care for your athletes. That is all I have, Megan. That is the end of my presentation. I'm hoping that you guys were able to take a couple snippets out of that. I really enjoy being able to talk about this. But yeah, that's all I got. So I'll hand it back to you, Megan, okay?
Jen, did you want to touch briefly on the personal story about the boy that you mentioned in the beginning?
Oh, that was the story. That
Okay.
was the story. I wanted to bring it back to Tyler. That I have those bracelets. I brought them to conferences, and I usually will give them out in person. And I just wanted to give that opportunity, that if somebody is touched by this story and they want bracelets, I am happy to send them.
Great. Well, thank you so much, Jen. This was fantastic.
Sure. My pleasure.
Nikki has shared an Instagram post in the chat. It turns out that my forms that I put in the calendar invitation were not correct. So I also linked to the course assessment and course evaluation. Please use these links that you can find in the chat. This was really great, Jen. Thank you so much for your time and your resources. Does anybody have any questions before we sign off?
I'm not putting my email in the chat. I mean, feel free to send me an email. And I love the mention of the infographic above. I know exactly what you're referring to, and it's phenomenal. As we just kind of get out of Pride Month, we just need to be mindful and inclusive and just aware. I think is important that the impact that we have as athletic trainers, and many will feel that safety. Hopefully they feel that safety in our space. So
Great. Well, thank you very much. And
yeah,
thank
you bet.
you for joining us. And we hope everybody has a wonderful rest of the day, and take care of yourselves and take care of everybody. Thank you, guys. If you have any questions, my email, I'll put my email in the chat too. Everybody should have my email, but I'll put my email in the chat if anybody has any questions about anything, about the assessment or anything, or any questions at all. Please feel free to contact me. All right.
Awesome.
Thank you.
Thanks so much. Thanks for having me.